Welcome everyone. This presentation is titled Hurricane Milton, Emergency Response Evaluation. Overview of the presentation, event and impact, emergency response, inclusion and DEI, Christian approach, worldview, and lessons in future preparedness, and role of CNP nurse. And next, Hurricane Milton overview. So, had landfall on near Siesta Key, Florida on October 9, 2004. It was Category 3 hurricane. The storm strength was initially Category 5 and weakened to Category 3. And the destructive impact, it generated storms up to 10 feet in some areas and a lot of tornadoes in Florida. In terms of casualties and damage, it resulted in at least 42 fatalities in the U.S. and an estimated of $34.4 billion in economic losses. In context, it occurred just 13 days after Hurricane Helene struck North Florida, compounding challenges for responders and communities already in recovery. Impact on community and region. It had severe local damage, power and utilities outage, and flooding and storm surge, and mass evacuation displacements, and long-term recovery challenges. So Hurricane Milton dealt a heavy blow, immediate destruction of property and infrastructure, massive displacement of people, and long-term recovery challenges that tested the community's resilience. The breadth of impact, from individual homes to large city facilities, highlights why a strong emergency response was critical, and it sets the stage for examining how effectively authorities and responders meet their needs. Emergency response measures implemented. It had early warnings and evacuations. Sheltering and relief centers were set up, and resource repositioning. So the National Guard were active and deployed. In terms of transportation access, to facilitate evacuation, tolls were suspended on major highways. And emergency response and rescue, as soon as the conditions allowed, urban search and circuit teams, Coast Guard, National Guard fan out to flooded neighborhoods. When Hurricane, so the emergency response to Milton was robust. Evacuations were executed early and likely saved many lives. Shelters kept thousands of safe during the storm, and an organized multi-layered response force, whether it be state, federal, local, and nonprofits, swung into action right after the storm, focusing on rescuing survivors and meeting basic needs. These measures effectively form a rapid response intended to reduce Milton's harm and set the stage for recovery. Response effectiveness in terms of evaluation. It was timely some actions and appropriate and coordination. Positive outcomes. Mass evacuation sheltering efforts are critical in preventing higher death toll. And challenges gaps. Despite successes, challenges emerged. The response force was stretched thin by back-to-back disasters. But overall effectiveness, the emergency response to Hurricane Milton was effective in many areas. So as the whole, the emergency response to Hurricane Milton was quite effective. It's clear that the current efforts of emergency management responders and community organizations prevented worse outcomes. People were moved out of danger in time. Those who stayed were rescued, and basic needs were met relatively quickly for most. The system, however, was tested and showed some stress factors, namely limited reserves of personnel and the difficulty of defaulting every last household property. And these are the exact kinds of insights that post-disaster evaluation aim to capture. In fact, not long after Milton, there were oversight hearings and reports to coordinate response, not in a negative way, but ask what did we learn, what can we do next time. In summary, I would grade the Milton response as largely successful and life-saving, with a few important lessons learned that we will discuss later on. inclusion of merged communities. It reached vulnerable populations. Shelters were accessible. Communication language. Community partnership, and as well as DEI in decision making. So the Hurricane Milton response has spread a genuine effort to include marginalized communities, transportation for the carless, specialized shelters for those with medical pet needs, multilingual communication, and direct outreach in underserved areas. These steps reflect an awareness that effective disaster response must reach everyone, not just the easily accessible majority. And the challenges and observed highlight the inclusion is an ongoing process, requiring listening to community feedback and adapting strategies. But the measures taken for Milton were a solid stride toward equitable emergency management. Christian World 50 principles provide humanity and equality, love and compassion for neighbors, service and sacrifice, justice and inclusion, and hope and restoration. So applying a Christian worldview in emerging response means actively living out principles of compassion, equality, service, and justice. It prompts responders to make sure that no one is left behind, that we seek out the lost sheep, so to speak, and bring aid to them. It promotes servant leadership, where leaders put the needs of the most vulnerable first, and increases the whole operation with a sense of deeper purpose. Helping others is not just a duty, but a reflection of loving God and neighbor. This perspective can greatly enhance the inclusivity and humanity of emergency response efforts. Okay. So next. So lesson learned and future improvements. It strengthens response capacity, enhanced communication and misinformation management, inclusive and data-driven planning, infrastructure resilience and mitigation, and continuous improvement and training. So when a similar event occurs in the future, and it will, given trends in severe weather, these improvements can be applied to yield a faster and more effective response, such that in the next hurricane, because we strengthen capacity, there are more hands on deck, because we improve communication, people get accurate information and help faster, and because we plan inclusively, vulnerable groups are proactively cared for, and because we mitigate infrastructure, the damage are less severe. All of that means fewer lives lost and a quicker recovery. The lessons from Hurricane Milton, if acted upon, will make future emergency response not only better in execution, but also fairer and more resilient. Next. So role of the DMP preparedness in disaster response, to responder roles, preparedness and education, and holistic delivery. So the DMP preparedness is like a linchpin in the healthcare response to disaster. They enhance clinical care quality and lead and organize nursing teams, ensure preparedness measures are in place, and cover the gaps between immediate emergency care and ongoing health needs. They lead with the heart of a nurse and the mind of a healthcare executive, which is invaluable in chaotic situations. Communities that have DMP nurses involved in disaster response likely see better coordinated medical relief and patients, including those who might be overlooked. So nursing leadership, moral courage and resource allocation, moral courage and crisis leadership, advocacy for the vulnerable, equitable resource allocation, and ethical decision-making integrity. The DMP preparedness leading in disaster will use ethical frameworks, compassion, and strong sense of justice to guide how resources are distributed and how people are treated. They will ensure that even in dire circumstances, decisions are patient-centered and fair. Their moral courage inspires others to maintain high ethical standards, and even when the scenario is chaotic or heartbreaking, in doing so, they uphold the trust society places in healthcare professionals that we will care for those in need without bias, with integrity, and with commitment to doing what is right. And these are the rest of it. So thank you very much.